Hi, my name is Felicity, and today I'll be presenting my applied project. It's the effects of functional communication training to teach manding and decrease tantrums across home and school setting. My specific research question is, will functional communication training for manding decrease the amount of tantrums occurring within home and school setting? My rationale for this is that communication is honestly a very vital skill. We all need in some form of way, whether that's ASL or through EAC device or PECs, to be able to communicate our needs and wants, whether it's just wanting a toy or getting a nice coffee or needing our basic life things such as food, water, shelter, etc. When it comes to who I'll be working with, that is my 3-year-old Alpa. He is a male with an autism spectrum disorder diagnosis. I am specifically doing this in his preschool as well as home setting. And with that said, there will be a preschool BT, home BT, as well as myself, his clinical supervisor, on the case. The sociability ties back to my rationale for this project. Communication for wants and needs is a vital skill within society. We also need to be able to kind of conform, and having tantrums is not only disruptive, challenging, but it can also cause a lot of distress for the individual and those around. So being able to decrease the amount of tantrums occurring and challenging behaviors while also teaching alternative behavior is not only a great way for our kiddo to be able to express themselves, but also helps them have a more fruitful and successful life within mainstream society. Previous research on this has shown a relation of using functional communication training to decrease tantrums. This can be seen in the 2008 study with a 5 and 6-year-old boy using iPad applications to teach manding, and so showing that is a replacement behavior for tantrums, as well as 2013 when a study was conducted in a preschool classroom specifically teaching techniques for functional communication training as well as self-control, which overall not only provided a decrease in challenging behaviors, but also allowed classroom setting to have a lot more, I guess, meaning to it as they were able to do more lectures and teach the kiddos vital life skills. Specifically to my project, we will be looking at the project description design, which is a multiple baseline method that will be added to this section right here. The independent variable is the functional communication training, and I will be looking at the dependent variables of manding and tantrums. So not only decreasing the tantrum, but also increasing our manding, which overall increases communication and language skills, which I love. The data collection will be collected by marking the frequencies of tantrums as well as the mandings occurring per session. Data will be taken by my BTs as well as myself when I'm supervising or implementing the intervention myself. I'm very big on taking IOA data for fidelity checks. So whenever that is able to be done, it will be done. The baseline procedure was marking only dependent mans and just simply praising them. There will be no prompting occurring, and every instance of tantrum that is specifically targeting access to tangible will be marked. Our FBA did show that kiddo has multiple functions for tantrum, and so it was really important that my BTs understood when tangible access was the actual antecedent. Training for intervention procedure will be FCT being implemented to teach manding. Initially, it was an error correction, but after doing a revision, we did an errorless learning, which conducted with BST to teach implementing a full verbal prompt right away, and then faded back to a simple gesture, which we found just going like this showed some promise as the data. Getting to the results of the study, I'm going to be maximizing my graph so that you can have a better look. Overviewing here, we see that baseline was showing lots of tantrums, specifically lots of tantrums happening in home. School still had some tantrums, but it wasn't as bad and as challenging. But we did notice that overall, kiddo had very low manding. There was varying frequencies observed between the home and school setting, and there was within a similar trend displayed within the intervention phase as well. Within intervention, ALPA displayed a decreased trend with tantrums within the school setting, which will reflect in the graph here. We can see that there is a downward trend occurring and an upward trend occurring with our Manding, which is great. It's showing that FCT is having some sort of effect. In home, there was also a decrease and then a random spike that occurred. And so that kind of really made me think and reflect based on what is occurring in the home, whether it's treatment fidelity, um, a barrier with rapport, or with parents. And we kind of found that there was too much going on to fully assess what the antecedent was. So on the back end, we took care of a lot of different aspects, and I wanted to be able to target each one of those barriers. Overall, I did see there was at least an increase in communication, which is great, but I still went in and did a change up with our BST training with so BST training was conducted by myself, and I spent a couple of days doing intervention with the kiddo with BTs along there. We did errorless learning, as I mentioned earlier, implementing a full verbal prompt. So the minute we saw the precursor of a child wanting something, whether that was an eye gaze or reaching towards, we immediately provided a 2 to 3 word phrase. And that almost immediately we saw here decrease, decrease in tantrum, increase in communication, increase in communication. This kiddo just knew it. It was great. So from then on, the BTs took over and we saw what we were hoping for, which was a positive result displayed in the previous phases of an increase in Manding and a decrease in our tantrums, which is great. It's showing that FCT is an effective strategy. As we can see, when we moved to prompt change gesture, there was still an increasing trend in what we wanted to see and a decreasing trend. There was some stuff going on with home, which will be being addressed with parent training. And as I move on to the discussion portion of my project, I'll elaborate a little bit more. So overall, in summary, the use of functional communication training for our kiddo ELPA did display to be effective and overall the decrease and increase of Manding, decrease in tantrums within his home and school setting. Uh, Honestly, when it came to just kind of looking at what was important, we had to really make sure that we were tracking our tantrums being access to tangible to make sure that our data was correct. A limitation that I observed and kind of was addressed, as I mentioned earlier, was specifically with treatment fidelity, making sure that my BTs knew what they were doing. And sometimes I found like the best way is by going in person and showing them how it has to be done. Also, proper parent training and agreement. We noticed we were all on board in school, but when it came to in home, parents still wanted to implement negative punishment, such as timeout and other things. And so making sure that we kept our treatment fidelity to be as close to 100% possible. So in the event that parents aren't implementing it, we can still decrease the amount of time that our kids facing that negative punishment from parents by having such a positive influence on their Manding. Uh, Environmental control also displayed to be inconsistent due to changes with school, as well as cancellations occurring with session, whether it was on kiddos' end or BT's end. A big takeaway, honestly, besides just the fact that functional communication has proven to work amongst my simple project and many others' elaborate research, is that it's so important to make sure that treatment fidelity is really being taken into place. And before that even starts, making sure that rapport building is strong and conducted in the initial phases of just AB in general. One of the things that I did notice on the back end with my home BT is that there was not a strong rapport. And so some tantrums weren't due to access, so we didn't mark them, but they're on the side within our own like company, we did see that we were marking tantrums because of escape, and it was escape from the BT. So it was one of those things where we had to take some time to really find the root of how we can make it better. And I just found that having strong rapport with our kiddos really causes us to not only be a reinforcer for the kid, but also make session go a lot smoother. We're there to help them. We're there to make sure that they progress. And so kiddo isn't looking forward to seeing us every day. That can cause barriers to our intervention. And so overall, I hope that you guys learned and took something away from this. I know I definitely did, and it has definitely made me a stronger soon to be BCBA. So I appreciate your time and thank you for watching.